Hey everybody, Dr. Nick Scotto here with River City Physical Therapy right in the heart of Jacksonville. Today I have a special guest with me in clinic, one of my former patients, Pam. Pam, I want to thank you for coming in today to share your story. So why don't you tell us a little bit about, you've seen me twice now for two different ailments. Why don't you go ahead and tell us a little bit about your first ailment with the foot, what was going on and how it affected you?
Well, I'm a daily walker. And I walk 2 miles every day, and there was a time where my toes started going numb, and I noticed as I kept walking, finally one time I was walking, my toes went so numb that I had to kick my shoes off with a quarter mile to go.
Okay, so the toe numbness and the foot numbness really got in the way of you completing your daily walk, so you want to stay nice and healthy because of that.
Also, they were numb even at home.
Okay, so they were getting numb at home, like just when you're sitting?
Yep, or just walk around, I could feel them. Driving me crazy.
Okay. And how long was this going on for?
By the time I started talking to you about it, probably a few weeks, because I thought it would go away on its own.
Okay. All right then. And had you seen anybody else for this at all? Or? No. Okay. All right. So Pam came in to see me. She's getting some numbness in both feet from her walks. She really enjoyed walking, and it was just really affecting her quality of life. And then so Pam talked about what we did and how we were able to help you.
Well, you gave me exercises to do at home, and then I started doing those faithfully. And then
that's the key right there. Do your exercises faithfully. That's going to ensure good progress.
Yes, and then it started to decrease to the point that now I rarely feel that. And sometimes I'm not good with the exercises. So when my toes start acting up again, then I start doing the exercises again, and then it goes away. So it really is being faithful with the exercises.
Okay. And how many times, I know it's a little bit back, but how many times did we end up kind of seeing each other to make sure you understood exactly what you need to do?
I think about 3 to maybe 4 times.
Okay. So about 3 to 4 visits, and we were able to resolve the problem. So that's pretty good. What do you think the key to you getting better was? Did you feel like you understood your condition and what was causing it?
Yes.
And how you were able to take care of it?
After you explained it.
Okay, good. So it was helpful. So we were able to show you the tools on what you need to do, and now you don't have to rely on coming to see me anymore.
That is correct.
And that's always a valuable thing, saving time and money, correct?
Right. Yes.
And then, so we helped you with your foot, and that was great. You had great results with that, only 3 to 4 visits. Now you're back to walking. How many miles are you walking?
2 miles every day.
2 miles every day. Do you have to kick those shoes off anymore? No. Okay. And so let's talk about now, you also had some back issues as well.
Yes, because I pulled it out when I mowed one day. But I've had back issues, so they're good. And then all of a sudden I was mowing one day and I yanked the lawnmower and immediately felt pain in the right side of my back.
Okay, and before that you had actually pulled a fence too, right?
Oh, yeah. I hauled a big 6-foot fence and pushed it up.
So we can see Pam is very active. She's a walker. She likes to do yard work. And these ailments can really get in her way. So let's talk about your back pain and kind of what we went over with that. How many visits were we able to show you helpful stuff to do to take care of that?
Well, those visits were about, I'd say, 2 to 3.
Okay.
And you gave me exercises again. One exercise I remember after, I think it was the second visit, it was an exercise you gave me that immediately, I could feel relief immediately. But then, of course, it is being faithful with the exercises. So,
right.
Yes. Right. And I like them, the exercises for strengthening my back. And I like the exercises then when my back is giving me little twinges, then I do those and the twinges kind of go away. So.
Okay. So in both instances, do you feel like we were able to get to the source of your problem or the root cause of your problem in your foot and your back?
Yes.
Okay. And do you have the confidence now to take care of yourself without having to rely on doctor visits and even coming back to see me?
That's true, because if I do the exercises, there was some you gave me the first time and they addressed one issue, and then I still was having a few more, and then the second visit is when you gave me the other exercises that addressed something totally a different kind of thing. And now between those 2 exercises, I'm getting good.
So Pam brings a very good point. It's not just one exercise that's going to get someone better. It's usually a cluster of exercises. And she's a great patient example because she's diligent on doing her exercises, and that's what got her better, and that's what prevents her from coming back to see me often. Our number one goal with Pam was to get to the root of the problem and treat her in as few visits as possible. And I know she appreciates that because you're your grandmother and you have grandkids that you like to take care of, pick up, and hold. So I know that's a big part of your life as well. So we knew that all that, walking, being a great grandmother to her grandchildren, all that was important to Pam. So time was of the essence. And getting her back to being healthy and not worrying about those pains was also important to her. So is there anything that you'd like to say to people who are out there who may be struggling with just ailments and pains, and what you think they could do about it as far as taking care of it?
Well, I would say come see you. That would be number one. Secondly, then whatever they choose to do, they have to it's like a prescription. If a doctor gives you a pill, you take it. The exercise is the pill. So it's a prescription is what I'm saying. So people need to be diligent about the exercises, and that's the biggest thing.
Right. And I stress that with a lot of people that come into my office. I pretty much tell them, I'm going to show you the path to get better. We're going to get to the source of the pain, and then it's up to you to be able to continue on that path to take care of yourself, where you're not relying on medications, injections, and then you can avoid surgery. Well, Pam, I'd like to thank you for coming in today. Like I said, you've been a great patient just because you do your exercise and you listen, and that's the key to getting better. And again, I'd like to thank you for coming in and sharing your story. If you like what you see here, you can give us a call at 904-566-7070. If you feel like you have some pains and aches that are keeping you from doing some of the stuff that you love, or if you prefer email, you can email me at nick@rivercityptjax.com. Once again, I'd like to thank Pam for coming in.
You're welcome.